It might be a difficult topic to talk about, but actually a lot of people deal with it. We're talking about incontinence and difficulty with urination or bowel movement. They can sometimes be a sign of pelvic floor dysfunction, and physical therapy, well, it could help treat it. Joining us to talk more about this, Selinda Shephard, a physical therapist with the Hartford HealthCare Rehab Network. Thank you so much for joining us today.
You're welcome. Thanks for having me.
So for those who may not know, what is the pelvic floor?
So basically, the pelvic floor is a group of muscles and connective tissues, and they basically create like a hammock or a sling position from the front of your pubic bone to the back of your tailbone. And this provides supportive structure.
Perfect.
And
go ahead. Yeah, no, go ahead.
And I was just going to say that basically for women, it will support your uterus, your bladder, your bowel, and men, it's going to be more of your bowel and bladder as well. So the issues will be different based on their anatomy.
Okay, interesting. What are some pelvic floor dysfunctions that people may experience, and what exactly causes those?
So most common is probably incontinence or difficulty with urination or with bowel movements. There's also sexual dysfunctions, constipation, and really the issues they may experience are going to be related to their anatomy and between the men and women.
And what is something that a person at home can do if they find themselves kind of struggling with that urinary incontinence?
I would say it's basically counterintuitive, but one of the main things you can do is to drink more water. And that's because you don't want to have the bladder being irritated by not getting enough water, which can potentially lead to bladder infections as well.
Of course, that's something they can do at home, but like we kind of alluded to, there are some treatments that are available for pelvic floor dysfunction. So tell us a little bit about what kinds of treatments we're talking about.
Yes, absolutely. So you can do biofeedback. We can do a lot of the manual physical therapy. There's medications, as well as there's relaxation techniques, which are very important when you're having some of the muscles that are too tight and not relaxing.
Selinda Shephard, thank you so much for taking the time to talk with us. For more information on pelvic floor dysfunction, visit Hartford HealthCare Rehab Network.org. You see it there right on your screen for more. Again, thanks so much for taking the time to talk with us.
Thank you. Bye-bye.
Well,